Hi, I'm Dr. Merlin, homeopathic physician. I'm here to speak about renal calculi kidney stones today. So we will discuss in detail about it. First, we'll talk about the causes. So the causes is recurrent UTI, bacterial infection. Those who have this burning tendency or urge to urination, they have this bacterial infection. Second is we see in hot climate, okay, those who don't drink proper water or they do too much of fasting. Here, what happened? The salt deposit, the concentration of the salt is increased and causes crystalline and then renal calculi. Third is the dietary factors. So it will be for the vegetarians and the non-vegetarians both. In the non-vegetarian, if they eat too much of egg, meat, we usually see there is a deposits of crystals and calculi. And also those who eat in vegetable too much of spinach, brinjal, tomato seeds, and in fruits we see too much of strawberries eaten, causing acidity in the urine. The pH of the urine is being changed, and we see renal calculi. And fourth is the obesity. Okay, what happens here? Because of the obesity or increase in the weight, we see renal calculi, also the bladder stones. Okay, so and also some nowadays they go for the surgeries. So what they do, they remove the part of the stomach, bariatric surgery, and then there is a problem in absorption of the calcium and the water, and that also causes for renal calculi. And next we see immobilization. In the patients like bedridden, it could be because of the age or because of the other disease like paralysis or any other tumors, cancers, and where they are bedridden, they also get this renal calculi because they don't drink proper of water, and also the attendant also is not giving proper water, and there is a in the sleeping position there is a deposit of the salts. And then it is a metabolic diseases. So any metabolic diseases like hyperparathyroidism or diabetes or gout. Okay, here what happens? There is an increase of salt concentration causing renal calculi. So these are the main causes for kidney stones. Now we'll talk about this type of the stones. Okay, there are mainly three types. One is the calcium oxalate stones. Second is the phosphates, and third is a uric acid stones. Okay, now in detail we will speak about it. So first, when I told calcium stones, okay, calcium oxalate stone because there will be layer of the calcium and the oxalate also. So this is a single hard stone which irregular shape and size. So it's very spiky and it's very painful also. And second is a phosphate stone. So here what the color is whitish to yellowish in color, very dirty yellowish in color, and this is a single and huge, usually seen inside the kidney and in the pelvic ureter junction. And third is the oxalate uric acid stones. So uric acid stones are in the people who already have gout. There is an increased deposit of the uric acid as well. So these are multiple tiny stones inside the kidney and outside the kidney and in the ureter or in the bladder. Okay, so these are the three type of stones. Now we'll talk about the symptoms. What are the symptoms? The first symptom is pain. So you have an acute pain here. So what they tell, loin to groin. That means they have this pain in the lower back here at the T12, okay, where the vertebra T12 is there. From there it radiates and comes in the forward. So this is a acute type of pain they have. Second is hematuria. Hematuria means bleeding in the urine. And third is guarding and rigidity. The pain is so intense that they don't want you to examine or they don't want you to touch. This is called guarding rigidity type of pain. And also we have seen people who have this sometimes might not have the active bleeding or hematuria, but they might have chills, rigors, vomiting, loose stools as well. These are the associated symptoms. Now, what is the treatment? Before going for the treatment, when you hear about hematuria and guarding type of pain, loin to groin type of pain, we send for a scan. It can be a scan or an X-ray, simple. Okay. So in the scan, we can see where is the stone located and what is the size of the stone. So this will help us to analyze what type of medication to be given and what is the dosage to be given. So this we finish with the investigation. Now, homeopathic treatment. Berberis vulgaris is a stone crusher. This is a medication which helps to break the stone. Okay, the size, if it is very big, it will help to crush the stone and then flush out to the urine. So you have to drink proper amount of water as well. Or else if you take medication and no proper, then it will not flush out. Okay, that is one important. So we'll talk about few medication. First is Berberis vulgaris. You get it in the tincture form and the dilution forms. You have Pereira brava, you have Sarsaparilla, you have Lycopodium, you have Tuja. These are the main medication, and depending upon the pain, you can give belladonna, you can give iris also. So I will discuss about one case today. So you can see the stone. Okay, this is an oxalate single stone in the pelvic ureter junction. Okay, so it is 8 to 9 mm. The patient first came to me with the intense pain in the loin to groin. That means she told I have a back pain and I have a abdomen pain both. And she had hematuria, she had bleeding in her urine. So I came to know it's a stone, it's a kidney stone, but we have to send it for a USG because I need to know what is the size of the stone and where it is located. Then she came to me with the reports and it was a single stone and it was 8 to 9 mm. So we should guess, okay, because it's a single stone. Hematuria is it could be a oxalate stone. It's very painful condition. So I gave her Barbas vulgaris tincture, 20 drops in half cup of water 3 times a day. And I gave her Barbaris vulgaris 30 in dilution 4 drops morning and night, half an hour before food for 10 days. And then since she also had intense pain, I had gave her magnesium phos 1000, 4 drops in the noon for 10 days. Within 8 days of the treatment, the stone was flushed out in the urine. Okay, so you can see how is the edges very irregular. This was a oxalate stone. And I will show you one X-ray how a phosphate stones look. So this is at the pelvic ureter junction, and it is round, circular, and big in the size. This is around 14 to 15 mm in the size. Okay, so you can comment or you can add any diseases and you want me to talk about it. So I will discuss in detail. So like my channel and subscribe it. I'll be there with you in the next topic. Thank you.